morning. On behalf of the Board of Directors of the Booker T. Washington Center, MCIC, we thank you for being here this morning to share some information with you today regarding what we're going to be doing as a Minority Community Investment Coalition. As you all know, this is unprecedented times that we're facing here today, here locally, throughout the state, and quite frankly, throughout the world. So we want to get together and provide some basic information to individuals in our community today, and most importantly to the underserved population and our constituents of Minority Community Investment Coalition. So first of all, I just want to mention some of the partners that we have here today. We have Samella Hudson-Bruton from John F. Kennedy Center, James Sherrard from the MLK Center, Gary Horton from the UECDC, Pastor Mark from the Interchurch Ministries, Brian Peterson as well from the E, and then we have numerous other guests, the mayor from the city of Erie, as well as Rich Connect from the health department. So these are some of the partners that are here today. Obviously, we've been reaching out from a community perspective of working with numerous partners. There are other partners that are part of this collaborative of programs and services that we're looking to help offer. Mr. Horton will speak to that a little bit, but I just wanted to make sure that we are aware of the partners and that we are working together to try to provide information, positive, informative, correct information to our community. So this is what we're doing here today. I also wanted to start off by letting you know the importance of having this meeting. There's a lot of rumors flying in regards to COVID-19 and what's happening throughout the country and what's happening throughout the world, as well as our state. So we want to be able to provide that information as a hub of information so that we're giving informative, correct information to our constituents. So this is the importance of this meeting here today. And then finally, for me, the importance of obviously everything being shut down, but the importance of still being able to provide some form of information and resources to our community. So I'm going to touch briefly, just a little bit, not to steal Mr. Horton's thunder, and then I'll pass it to Mr. Horton. But first of all, today the Erie School District is rolling out their food plan. And they're going to be serving from 16 schools today throughout the district. And so that's an important piece. As you all know, even with the COVID-19, it's very important that we still have the opportunity to feed our youth and our families in our community. We have to find a way to continue to do that. And the Erie School District has started that today. And we had some conversation with them, and we're working through some other details that may be coming out here shortly. And later as this progresses. Today there is some other opportunities that Mr. Horton will touch on in regards to some of the funders that we're working with closely to try to provide some resources through this specific pandemic. There's going to be some basic needs that our community is going to need, and we're working with Erie Community Foundation, EGRA, and others for some funding opportunities and resources for organizations such as ours. So those are just a couple different things. Mr. Horton's going to maybe go into a little bit further of some opportunities and resources and information and partners and partnerships that we've created and that we're working through. As you all know, this is a very fluid situation. So there's going to be things that are going to be happening very quickly. And so we want you to understand that there's some things that we're bringing to you today, but tomorrow may change in regards to some of the resources that are available that we're going to be able to work with partners and other organizations to provide to our community. So with that being said, thank you for the time and opportunity. And just so you know, our organization will have individuals working the phones. So if people have questions or concerns, our services here at the Booker T. Washington Center are at a halt or at a standstill, but we want to make sure that people can still call and get information if needed. So with that being said, I want to introduce the Executive Director of the Urban Erie Development Corporation and the partner of MCIC, Gary Horton.
Thank you, Chantel. First of all, I'd like to give honor to God, from whom all our blessings flow. We're, as Mr. Hilliard said, in uncharted waters, unprecedented time, not just in our lifetime, but in the time of our young country. If there was ever a time that we needed to stand on our faith, whatever our faith is, today is that time, these times that we're in. And with that, I am called to memory of the importance of the services that we provide and the people that we serve. It's not enough for us to pull the window shade down and turn the lights out and lock the door and go home with our families and self-quarantine or any of the other recommendations that have been made. When we know how essential the services are that we provide for some of the most vulnerable people in our community, people who have language barriers and cultural differences, very young children to very old seniors, we provide services for them. And the poverty in Erie is not going down, it's not flat, it's going up. And so we recognize that the majority of people may not have access to Wi-Fi. They may not have at their fingertips the technology to keep up with the latest information and direction that the country should be moving into. In the midst of this international crisis that we are in, we recognize that we also have a national emergency, and it's been declared an emergency in our county. And as a result of that, it requires local leadership. And so we are happy to be able to join the mayor and the county exec in their declarations of directions for the local people, how we can be inclusive and accessible to the people whom we serve. I feel a little bit that I understand even more how police officers, families, and how firefighters and people in the front line feel when they see their loved ones go out the door to manage the affairs of our community and hope that they return home safely. While we don't wear a badge and a uniform, Mayor, we are very essential in this time of need. In my particular neighborhood, there are a number of industries share the same neighborhood as the John F. Kennedy Center. And we know that there's a high incidence of respiratory ailments in the populations that we serve. We see it in our youth, our infants, we see it in our adults. This is a respiratory disease. It attacks the respiratory system. And so we are uniquely acquainted to the challenge that we face. We also are inundated with public housing where people live very close together. They do things together. It's been encouraged. And now we're trying to develop and implement protocols that call for some difference in that. People need help. They also need to be able to trust the message from the government is going to be consistent and believable. And so we know through the history of our work in the community and with these populations, they've come to trust us. They've come to know our number. And we have to be available and able to respond. And with that, we do appreciate the Erie Community Foundation and the Erie County Game and Revenue Authority and our local government being sensitive to the fact that we have workers and people who provide those services, also that may need to be supported if they take off work or if they, some grant requirement says that, that you're doing something different than what the grant recruits, what you wrote in the grant. All hands on deck is what we need, and we're just trying to do our part. And what we found out in the history of our country, when we faced challenges like this in the past, so we've come together. And we see how the local community college issue brought interchurch ministries and the Bishop's Roundtable and the African American Concerned Clergy and other churches together to try to promote what we felt was in the best interest of the communities that we serve. Well, same as this issue right here. It may impact our vote that's coming up. It may impact the census that is underway. And so, not to alarm the people, but to reinforce the necessity of the services of the neighborhood centers that we provide every day. And we work often 7 days a week. We're on call 24 hours a day. And people know our number, they find us, and we want to be able to be responsive in the information that is released. We want to be able to be useful and accessible for the people who fall through the cracks in the food distribution systems. We want to be a bridge to the health, and that because we know in a lot of cases our kids and our families are the most vulnerable when it comes to that. They may be the last one to get the message. And so, although the governor called for community centers to close, while we may shut down our services, we will have people available at the phone, and we will be accessible to meet the needs of people as they come about. We know that poverty doesn't wait; it doesn't take a time out, and so to that degree, we appreciate the fact that it has provided us an opportunity to join together to work to try to meet the challenge that we face. With that, it is my privilege to introduce someone who is not a stranger to our community or the challenges that we face, and that's the mayor of the city of Erie. And he's a man of faith. He's rooted in the community, and he has a history of working with us. And to that degree, it gives us even more confidence in that our services are appreciated and recognized, and will be put to use and not asked to go home. Much like the media, you're not going home. We know that you have a responsibility to the community, and you have families also, and it's not like you're immune from the health challenges that we face, but you still show, and you still do, and that's the same that we have, and to that degree, Mayor, we appreciate your coming. We'd like to hear a few words.
Thank you, Gary. I can tell you at the city, we're 100% committed to limit the spread of the COVID-19 virus. This has really, at least for me, and I think for a lot of people, caused like almost an unreal feeling about how things are right now. But the steps we're taking are very important if we're going to keep people safe from this disease and keep them as safe as possible. The most important thing we must all do right now is not spread the virus through physical contact, such as shaking hands and keeping our hands away from our faces. The virus droplets enter through the mouth, nose, and eyes primarily. We must prevent that. If we do, we're going to kill the virus and end the pandemic. Our community centers serve a group of people who are too often overlooked in our community. I thank James Sherrod, Gary Horton, Chantel Hilliard, and Samela Hudson-Bruton for what they are doing today. I'm proud to be here and support their efforts. Finally, I'd like to remind you of 9 preservation measures that will keep us all healthy. Simple things. First, stay home if you're sick, especially if you have a fever. Second, wash your hands frequently with soap and water for 20 seconds. Third, if you can't wash your hands, use a hand sanitizer. Fourth, do not shake hands or hug anyone. Fifth, keep your hands away from your face, especially your eyes, nose, and mouth. Sixth, When you cough or sneeze, cover your mouth and nose with a tissue and then discard that tissue into a lined trash can. 7, disinfect surfaces by wiping down things like doorknobs, desktops, phones, and keyboards. 8, do not go to large events, and the latest on this is we should not attend anything with more than 10 people at, which we're all violating right now. 9, when you're out in public, stay at least 6 feet away from anyone. We have seen how the COVID-19 virus has shut down many countries around the world, especially Asia and Europe. We have the opportunity to learn from them what happened there and significantly reduce the amount of sickness and death that occurs here. Again, thanks for being here. Thank you for what all of you are doing. I'm going to turn it over next to Pastor Mark.
Thank you, Mayor, and to all who have gathered. We stand here as a part of the faith community, and from the Christian faith perspective, we understand that obedience is better than sacrifice.
Amen.
And so we stand on behalf of the African American Concerned Clergy, the Interchurch Ministries, and another organization called Our Church Matters, which are interracial and interdenominational entities that are building bridges. So we stand to just say to the faith community, to the leaders, the clergy, that we do not stand as the Pope, but the Pope can say something and people fall into line. But there's no Pope as far as the Christian community. Every pastor is a bishop. But we simply say that those of you who are clergy, who seek to understand what the faith response might be, we're going to be depending on the African American Concerned Clergy social media page. And on that page, you will find some faith responses to such things as weddings and funerals and worship services. I want to only also say that when you don't know what to do, there are some things that the Bible tells us we can do, and that is fast, we can pray, and we can worship at home, and maybe God is trying to tell us that we need to bring the family back together and be around Christ so that we might find out what we should have found out by going to church. So that's just a little commercial for Christians. But in all seriousness, we want all of the faith-based community to know that we are in partnership with the community. We're in partnership with business. We're in partnership with the community centers. We're in partnership with the mayor and with the county exec. Because we are a part of a village. It takes a whole village to raise a child, and it takes a whole village to have victory over a virus. So this is not the time to be pleading the blood. This is not the time to be using scripture to justify our disobedience to the mandates that are coming down from government. This is a time for us to show ourselves faithful and to be in step and in line with the safety measures that are needed and for us to beat this virus as quickly as possible. So please use social media. Again, we will have on our page, the African American Concerned Clergy page, linkages to the community centers and also ideas and suggestions on how we might continue to be faithful to our mandate to worship God in spirit and in truth. Thank you.
At this time, we'd like to invite Rich Connect from the Health Department to come up and provide an overview of the COVID-19 virus process.
And what the county is doing.
What the county is doing, of course.
There's a lot going on in the health department. We're dealing with a situation we've never seen before, we've never practiced or exercised for. So it's as new to us as it is to the rest of the community. As far as the coronavirus, or it's known as COVID-19, there is none in Erie County at this time.
None, no.
Pulled the numbers off our website this morning. Erie has 0 confirmed cases of COVID-19. Pennsylvania as a state has 79 confirmed cases. Ohio has 50. New York has 950. Half of those are just in the city of New York itself. There are 2 messages we, the health department, want to bring out to the community. And one of them, the mayor has already mentioned hand washing. but because it's so important, I'm going to repeat. Hand washing is probably the single most important thing that any individual can do to prevent the spread of not just coronavirus or COVID-19, but the flu. Viruses are spread by coughing or sneezing. They're spelled as droplets. Droplets settle on surfaces. You touch those surfaces. You bring your hand to your face approximately 400 times a day, and that gives the virus plenty of opportunity to infect the body. So please, wash your hands, and as the mayor says, 20 seconds, count to 10 and do it again. The other thing you're seeing, and you're going to see even more of, is social distancing. That's one of the reasons we went into the shutdown pattern that we're at right now. We need to separate people and keep those who are infected away from the uninfected. Back in 1918, when we had the Spanish flu, which was a pandemic very similar to this one, the city of Philadelphia had 12,000 people die in a 6-week period. And that was from the Spanish flu. In the same period of time, St. Louis only had 700 deaths. What did St. Louis do? They did what the city of Erie and the county of Erie and what a lot of the nation is doing. They shut down, closed churches, schools, bars, all kinds of businesses except for essential services. So Philadelphia, 12,000, St. Louis, 700, social distancing, it works. Please, when you're out there, stay away from people for at least 6 feet. I know I went around to a couple of the convenience stores, supermarkets, bagel shops, donut shops this morning. People are lining up one behind another. Step back, give yourself plenty of room. Keep 6 feet away. Don't gang up 6 in a line back to back. That's one way of passing on the virus, and that's what we don't want in this community. Thank you.
So today, before I get into some of the precautions that I'd like to allow you to understand, I did want to introduce Jeremy Peterson. He's with the E, and Jeremy and the company has been very instrumental in providing transportation to all the children that attend public schools so that they can ride the bus and pick up their breakfast and lunch at any Erie school district school while this year process is going on. MCIC is currently working with the E to try to expand that rider transportation initiative so that we can actually work out something with the school district to pack a bus with meals and have that bus driven throughout the communities where our children live in order to bring them the lunches. We all know that children that are in kindergarten through 5th grade aren't going to get on a bus by themselves without a parent doing that. So that creates an issue for us. So we're looking at other alternatives and working with the E, and we appreciate Jeremy coming in today to support what we're trying to implement to get meals to our families and make them more accessible. So thank you very much, Jeremy. So on behalf of the partners and our board of directors, we just want to take this time again to reiterate the precautions every family and person should be taking during this time of the COVID-19 virus. We know and understand that there is a lot of information out there and it may be confusing for you. So we took the challenge upon ourselves to come to you and provide it to you in layman's terms so that you can all understand it. As was mentioned earlier, we're all on the front line and we'll be available to answer questions through our regular phone numbers at our agencies. The necessary precautions that you should be utilizing during this pandemic time, we want to give you, first of all, give everyone hope and a sense of managing the fear that you may have because there's so much information out there being distributed to you on a regular basis. Continue to have hope and understanding in order to get through this here, as we all will. With that said, these are the precautions that everyone should be taking until further notice. there's a flyer that is out there, and we'll be posting this flyer on our website so that it's accessible for everyone. Every family can download it. If you don't have a copy of it, contact our agencies and we'll make sure you get a copy of it. So I'm going to go through these here steps on this flyer that was sent to us from the Senator's office. Philadelphia Senator Hughes. So how do you prepare? We know that there's been a rush on grocery stores, purchasing, toilet paper, sanitizer, and things of that nature. Well, your preparation needs to go further than that. You need to create a home emergency kit. That's just so that you have food available, because we don't know how long this is going to extend out. But having non-perishable food available to feed your families will be very important during this time. Our food bank will remain open and accessible to anyone that is in need of food also. Just give us a call and we can make an appointment with you and bring a bag out to you. Also, during this time period, make sure you have bottled water available, along with the various medications that your family members may be utilizing. We don't know how far this is going to stretch, but we all know that we cannot have our medications as we move forward. So we have to make sure that we have a strong medication supply accessible to us. Ensure that you have a flashlight and batteries, first aid kit. Allow yourself to have warm clothing. We don't know that what this will be, but we have to be prepared with an emergency kit in case it extends further and other things happen along this. It's very important that baby supplies be on hand too. If you receive services through the Women's and Infants and Children's Program, those locations that provide services to the community will remain open because they are essential services. We don't want any children that are enrolled in the program to go without. Along with children, we all have pets and animals, and so we have to also prepare for our pets and animals to have the same food and nutrition that will be available. The most important of being prepared is to understand the symptoms of this virus. I cannot tell you enough that if you have a temperature, you don't typically have a variation in your temperature, go to the doctor, go to the emergency room. If your temperature spikes over 100, I would say even if it's 99 out of the norm, go to the emergency room and get checked. If you have a cough, that is another reason. If you have a continual cough, go to the emergency room to get checked. It's better to be safe than sorry during this time of this pandemic. Also, if you're experiencing shortness of breath, it could be another sign that there may be some complication. We're not here to scare you. We're here to provide the information necessary for you to be safe during this here time period. The mayor talked about the everyday precautions, as did Rich, talked about the everyday precautions that we should be taking. I want to reiterate those because they are extremely important during this time period. Wash your hands. Wash your hands often. Anytime you can wash your hands when you're not in your own facility or your own home, go into your restroom, wash your hands for 20 to 30 seconds to make sure that you're eliminating germs off of your hands. After, don't touch your face during any time period during this here quarantine, this here process that we're going through, okay? It's very important that you don't allow the germs that you may acquire on your hands to get into your eyes, get into your ears, get into your mouth. So make sure that you keep your hands away from your face and so forth. And a very key thing to do also is to avoid people that may appear to be sick from your visual understanding of seeing them. We have to be very vigilant and understand that this is beyond where we are in our city today. The governor, the mayor, the county executive, the Department of Health have all put out regulatory processes that we need to follow. So I encourage you, if you don't have the information, check on one of our website pages, check on the various Facebook pages, and the information will be available to there. If you don't understand that, please reach out to the health department, reach out to the mayor's office, reach out to our organizations, and if we don't know the answer, we'll get the answer to you. We call for your support during this here time period, and we just want to thank the media, the mayor, and everyone that gathered today to help us put this message out to our community. With that said, I'm going to invite Mr. Hilliard up to provide some comments.
Once again, thank you for coming out for this informational press conference. At this further time, we'd just like to ask the media if there's any questions or anybody in the audience.